That's what an orthopedic test does. It puts a little bit of stress on the healing ligament, and it triggers a painful response. So this makes sense, right?
Oh, yes.
If you have limited range of motion and a positive orthopedic test, it's a sprain.
Right.
Or a strain if you're dealing with a tendon. So you've got problems with strength and flexibility. The other two problems are not nearly as intuitive. Ligaments, remember, there's only nerve endings in the sheath, but scar tissue is loaded with nerve endings. So scar tissue typically has between 4 and 10 times more nerves in it than you would find in a healthy, normal ligament. Guess what that means, Chris?
More pain.
Yeah, and the other issue with these nerves is they have a much lower firing threshold than the nerves that you would find in the normal sheath. So not only do you have 10 times more nerves, but the nerves are hypersensitive. And as the nerves grow into the tissue, they can often become tangled in the fibers. So now you've got all these new nerves growing in there, getting tangled. And this is why a patient, when they get up in the morning and they start to move their blown out knee, they go, oh, it's so stiff in the morning. Well, it's because of that scar tissue, and it aches and it's painful. Sometimes it'll ache just laying there, especially if you try and stretch it, it becomes painful. And it's because of all those extra nerve endings in it. So the two issues are you've got hypersensitive nerves. You've got lots of them, and they're tangled in the very non-flexible joint, in the non-flexible wound, okay? And so these are the 4 primary problems that we have to deal with and that we have to try and correct. And we deal with, any questions about the 4 negatives of scar tissue?
No, I'm good with that.
Now, the thing to remember is if you're seeing one of our patients and they've already been getting chiropractic care in our office, we've already educated them on exactly what I'm explaining to you. We explain to our patients. Now, we do this over a 4, 5, 6, 7 day period. And so when they come to see you, this will be in their head. Now, you'll probably remember everything I told you just because you're familiar with this. But the patient, so you might learn this 10 times faster because you're just remembering what you've already learned. The patient will actually come in, and this is the framework. This is the justification we've used to treat them in our office. So everything, part of your job will be to explain your role in this process. And it should be actually pretty easy for you to go, okay, you remember the 3 phases of healing that, Dr. Opdahl taught you, and they'll go, yeah. And you'll say, here's my job. Here's how I'm going to help you. So you'll want to be able to explain this and your role fitting in. And that's what we're trying to do today. You need to be able to explain what I'm explaining to you. I'm going into a little bit of detail, but you're going to be able to need to do this in a 5 or 10 minute period very quickly. And at a very, like at an 8th grade level to a patient. So because it's very critical that you explain, this is what we're doing. This is why you have problems. This is how we're going to fix it. So that's why
it's
excuse me. Thank you. So any questions about this? We keep it real simple. There's 3 phases of healing. We break it into silos, where we just explain inflammation, then we explain repair, then we explain remodel. And each of these phases has challenges. And all of our therapies are designed to eliminate the challenge in the inflammatory phase. So here's how we treat inflammation. Here's how we treat the repair problems. Here's how we treat the remodel problems. Yeah, you'll want to practice training your wife and kids on this too. Have a family night together, where you sit down and say, let me explain to you why you're going to be arthritic and all messed up as you get older. This is why joints don't heal good, okay?
Okay.
Okay, we got 4 negatives. There's almost nothing we can do for the increased number of nerves. But this is why, because once the nerves are there, you can't get rid of them. And they're always going to be hypersensitive. But as we untangle this scar tissue, the nerves become less pinched and less trapped. As we make the scar tissue more flexible, the nerves don't get fired or trigger as easily. And if we can strengthen this area, then they don't tear and they don't trigger a new inflammatory response. So that's also why we're trying to limit the amount of inflammation, because the strength of the amount of scar tissue produced is directly related to the duration and severity of inflammation. So if you're inflamed for 3 days, you'll get a nice blob of scar tissue. If you're inflamed for 3 weeks, you're going to have a massive buildup of scar tissue, and it's going to go everywhere. And that's what results in adhesions. And that's also what creates even more problems as it starts to stick to healthy tissue. Because as you start to move and repair this area, you literally have to break up some of this scar tissue in the area. And it's painful and it creates more problems. And it creates, every time you break it up, you start triggering a new inflammatory response. So it just creates this cycle that's very negative. Okay? So the heart and soul of treatment is about the type 3 collagen. The reason that people always ask, why does your body use type 3 collagen if it's 30% weaker than type 1 collagen? And the reason it uses type 3 collagen is type 3 collagen is very malleable, it's very plastic, and it's very responsive to stimulation. It responds to electricity and specifically microamps. So we're not talking about Russian EMS or anything like that. We're talking about very, very tiny millionths of an amp, the fibroblasts that are making the type 3 collagen. And it's the piezoelectric effect. As you stretch and pull the ligament, it yanks on it, creating a tiny charge, positive on one end, negative on the other, and the fibroblasts will lay the fibers down. So when I do a chiropractic adjustment, my job is to stretch that ligament rapidly, pulling it in the direction I want the fibers to line up. So when someone comes in, they go, my neck is killing me. I grab their neck and I twist it in a way that stretches the ligaments diagonally. Well, along the fibers I want it to go. And as I do that, what happens is the fibers, which were all tangled like this, as I grab it and yank and pull, they start to line up, and they line up straighter and straighter. So immediately after an adjustment, these type 3 fibers are slightly straighter. They're not this straight, but that's kind of what happens. And that's why after you adjust somebody, they get up and they go, wow, I can move my neck again. Not just because it's less painful, because I triggered a huge, so there's two things that happen when I adjust them. You get what's called an afferent bombardment, where essentially because it's so rapid, because that pop, that cavitation in the joint, it triggers literally every mechanoreceptor in that joint to fire all at the same time, which sends a wave of input into the brain. It's kind of like when you scratch a mosquito bite. You haven't gotten rid of the itch sensation. Right. You've simply overwhelmed the inputs. By scratching the area, you create massive stimulation that covers up the itching sensation. And your brain can't pay attention to the itching sensation and the scratching sensation at the same time. But once the scratching sensation wears off, then your body can notice the itching again, which is why you have to keep itching. You're doing the exact same thing by triggering the mechanoreceptors. So that gives the instant relief. But what actually gives you the lasting relief is the fact that you straighten out the nerve end, straightened out the scar tissue, the type 3 collagen fibers. Now, the problem with the adjustment is that it's very temporary. It took less than 1 second. So you've stretched out all the fibers, they've reorganized themselves, but the body's still producing scar tissue, so it immediately starts dumping more scar tissue, and those fibers start to shrink back a little bit. And so we do lots of adjustments at the very beginning of the repair phase, because the more adjustments you do, the more stimulation it creates. And the straighter we get the fibers, guess what that does to strength?
Right, it goes up.
Yeah, and like I tell patients, you can double, triple, and quadruple the strength. That's how you go from 10% strength all the way up to 80% strength. constantly stimulating the fibers.
Right.
And again, more is better. Now, the problem with the chiropractic adjustment is it's very gentle. It doesn't tear scar tissue for the most part. It can a little bit if the adhesions are there, but normally forming scar tissue, it's not going to irritate. And that's why when we adjust patients, about 10 to 20% of them get sore after their adjustments. Most of them don't. The second thing too is, again, the adjustments by themselves are typically insufficient to get optimal outcome. They might get your strength back to 40 or 50% by themselves, but because they're too gentle and they're too short duration, they're not enough. So that's when we add in exercises. Exercise actually add quite a bit of stimulation. But the most effective way to strengthen a ligament or a tendon is with a slow, aggressive, lots of weight, which is the opposite of adjustment. Adjustment's fast and light and gentle, and traction is a 10 to 15 minute sustained pull that takes advantage of the fact that if you pull a ligament or a tendon and you hold it for any duration over 5 minutes, it begins to creep and stretch even further. That provides massive stimulation, and it's probably 4 times more effective than adjustments or exercise in toughening up. So a core characteristic in our office is we do lots of traction. We do the exercises because they provide their own unique benefit, and we do the adjustment because they provide the benefit. But typically you're going to do adjustments immediately in the inflammatory phase. You would never do traction in the inflammatory phase because you're trying to get rid of the inflammation, and traction is too aggressive. But as the repair phase ramps up, we're doing lots of adjustments in the beginning of the repair phase. We begin traction at the beginning of the repair phase, but very gently. Instead of stretching for 15 minutes, we stretch for 2 minutes. And then we do it more aggressive as fast as the patient will allow. And then by the end of the repair phase, we're doing really heavy weights. And the adjustments are still useful, but they've lost a lot of their value. They're not as useful. There's that diminishing returns that you're getting. And then the final part is you start doing exercises halfway through the repair phase. And the exercises tend to be most effective during the remodel phase. Any questions about that?
It all makes sense.
Good. No questions?
Not yet. I mean, it seems like the model that you put forward of adjustments, a little bit more aggressively adjusting, phasing into a little bit more of stretching and traction with the exercises all seems great. And I'm thinking that the repair phase is a great spot for PRP as well, to
You got it.
those products to the tissue.
Yeah.
Continuing to heal.
And we're going to let's talk about that for a second, but let's cover real quick. Now, if you're going to an MD and you're in the middle of the repair phase because you waited 3 or 4 or 5 weeks and you still got ongoing inflammation, but it's been 3 weeks, so your body's cranking out massive amounts of scar tissue, and you haven't been educated properly, so you're doing normal activities that are actually tearing this scar tissue, creating more inflammation, and instead of rehabbing it, you're not rehabbing it, so the scar tissue that's forming is crap. And then the MD says, hey, let's take some anti-inflammatories, or even worse, let's take some prednisone to reduce the inflammation. Do you know what prednisone does to forming scar tissue?
I feel like it makes it a lot weaker.
It does. And one of the main reasons it does, the same thing with any anti-inflammatories you take during the repair phase, even Advil.